how most offices handle prior authorizations today, and then how do you fix it?
Wherever, like if you take a step back and you think, where would I need a medical assistant?
I think you hit the right point, having someone in-house and also having someone offshore, and then they're both working together in tandem.
The whole healthcare field, right, is fix everything up front. Make sure everything is taken care of. Definitely the HIPAA certification is big. You got to make sure that your patient information is secure.
Most healthcare practices don't have a growth problem. They have a leakage problem. Claims that never get paid, front desk drawing in calls while doctors burn out seeing patients. Today's guest has seen nearly a decade in healthcare, building solutions that fix what's broken before adding anything new. Tim Boyle leads sales and business development at Reva Global Medical, and before that, he played professional hockey. Let's get into that. Tim, welcome to Healthcare Business Growth Conversations.
Hi, Rakesh. Thanks so much for having me on. I'm happy to be here.
Yeah, and I have got to start here. Most of my guests come from a professional medical background, and then we have few from the marketing background, but never had a professional from the hockey background. So I just wanted you to talk about a little bit more about your hockey background and how you transitioned into the business development.
Yeah, absolutely. And I'm not actually the only hockey player over here at Reva Global Medical. Our owner, Bob, was also a former professional hockey player as well, which is pretty cool and builds a great atmosphere for our team. To get a little bit about how I transitioned is my last year of playing professional hockey. I was actually out in Boise, Idaho. And when I was making a move, I herniated L3 to L5 and was in a hospital bed for 3 days because I was just in so much pain and really was debilitated. I couldn't move. So from there, I tried to do a lot of rehab. I tried to get in the pool, try to do everything I could just to get my body ready for that next season. And unfortunately, I tried to go and it just wasn't working. So from there, I had to make a pivot. And at the time, because of my back being in such pain, I was wearing these recovery sandals. So the recovery sandals, they're called UFOs. And basically what they emulate is rolling your feet out on the top of tennis balls. So it takes some of that stress off your knees, your hips, and your back. So I liked the product so much and I needed to transfer out of hockey that I decided, hey, let's get into this. Let's see if I can make a call over to UFOs and see if they need anybody to help sell the product, because I was a professional hockey player. I'm one of 13. So I know a lot of different personalities, and I figured sales would be the best avenue for me. From there, my oldest sister is a doctor, and I'm going to fast forward a little bit here. My oldest sister is a doctor, and from the UFOs company, I went to the reimbursement technology space, and I was in SaaS sales for a company that basically does reimbursement for any claims submitted that have been rejected. So that's how I kind of got my knowledge in the healthcare space, in the reimbursement space. And after speaking with my oldest sister, who is a doctor, I've realized that there's been a lot of bottlenecks in practices, and there was definitely a niche where what we do here at Reva, the virtual professionals or offshore staff, could help these places, because a lot of small practices are dealing with they have a lot of overhead, clinical work that they have to do, a lot of clerical work that they have to do, but they don't have enough staff to be able to do that work. So they don't get paid out for a lot of services that they render. And then it just going down the line, it brings a lot of problems their way. I wanted to make a difference, and I coincidentally got a call from Bob, who knew me from the hockey world and saw my work in the reimbursement space, pitched me the company, and here we are.
Well, first of all, I'm sorry to hear about your back that couldn't help you to go back to hockey, but the way you pivoted is inspiring. Back into the grind with the sales.
Yeah.
That's a good pivot that you had. And then, does Reva Global Medical solve this problem for hospitals, private practices, and any other business, even labs? Or could you please elaborate on that?
Yeah, so absolutely. So if you think about if you take a step back and you think, where would I need a medical assistant? So anywhere you would need a medical assistant. Our niche is specialty practices, anywhere from a dentist office, IVF practices, diabetes and thyroid clinics. That's our niche, but we can really work anywhere. We can work in hospitals, we can work in labs. What we're able to do is just if you look at a hospital or a healthcare workflow, it's a lot of clerical work and a lot of clinical work. So these doctors and these practice managers and the people who run these practices, they go to all that school to handle that clinical work. But a lot of the times they end up having to do most of the clerical work themselves because the staffing issues are there. So what we do is we can help anyone basically give you a more efficient workflow by taking some of those clerical tasks off your hands.
Got it. So I think in one way, you're solving another problem of burnout for these practice owners because that's what I hear most of the times. So
Yes.
just on that line, now at this point of time, provider burnout is at an all-time high. So how much of it, in your experience, is actually a clinical problem versus an administrative one?
Can you just repeat that question you went a little bit there, if you don't mind?
Yeah, yeah. So the provider burnout, how much of it in your experience is actually a clinical problem versus an administrative problem?
I think it's mostly an administrative problem, right? So if you
Mm.
look at the clinical burnout and you look at a front desk manager, so if we just go in a day to the life of a front desk manager, they have to do that patient care, that face-to-face patient care, of course, right? When the patient comes into the office. But when they're doing that, behind the scenes, they're also having to book appointments for the future for future patients and chase down insurance for patients that have already came in. So they're going to work, and every time you call an insurance company, that can be a 40-minute call. So when a patient
Right.
comes in, they have to hang the phone up and then they have to start that process all over again. You can imagine after a while that would get very tiring and very tedious. The burnout comes a lot from we're asking our front desk manager and our office admin staff to wear too many hats. And
Mm.
of course, it's very difficult to hire in-house because of how expensive it is. But you need to find a way to be able to handle these clerical tasks that are chasing down insurance so you can get reimbursed for those claims that you're doing. So that's where we kind of came into play. We're able to give you the same result for a fraction of the price, and it helps alleviate that burnout. But to answer your question, it's definitely comes from the clinical side.
Got it. So most of the burnout is on the admin side. So in your opinion, why can't these practices are doing the right hires either in house or now outsourcing it to someone else?
Yes. If again, I might have missed your question a little bit, but I'll dive in here. What we've found is hiring in-house, especially so I'm in Connecticut, the New York, Connecticut area in the Northeast. So for us in the Northeast to hire in-house, it's like 80 grand a year for a medical assistant. And then if you do the math out for a virtual assistant, where we charge $12 an hour to handle the same task. Obviously, you're not going to have that patient face-to-face patient care, but everything other than that, our virtual assistants are able to handle. And that's at $12 an hour. So if you do that math out, it comes to around between 32 and 34 grand a year. And
Mhm.
that's just going to be a significant saving for these practices. And when you save that much money a year on staff, you're able to scale your business and build your practice.
So you're providing at almost 40% of the actual cost. So if some in example in Connecticut it might cost K and then you're solving that problem at K with
Yes.
higher efficiencies.
Yeah, correct. So the business plan that we look at and we like to consult with our clients is we like to have we'd like to have one medical assistant staff in-house because it's very important for when a patient comes into the office to be able to talk to someone and be able to get that comfortability before they go into their appointment. But other than that, you can delegate those tasks to an offshore assistant as well. And that would be the best way that our business would work, would be having someone in-house and then having offshore staff as well.
Yeah, you did I think you hit the right point, having someone in-house and also having someone offshore, and then they're both working together in tandem. And then the bigger story here isn't money just saved, it's money recovered as well by using the effective team.
Yes. Yeah. So, and I can give you a little bit of a story if that will help our cause here. We
Yes,
work with,
please.
yeah. So we work with an IVF practice who is dealing with this front desk burnout per se, where
Mhm.
if you think about an IVF practice, those tests that they run are very expensive tests. So for insurance verification, insurance discovery for claims that have been submitted that have been denied, that process is very important for that staff to go out and chase those claims. But it's a rigorous process. It takes a long time. So we had one IVF practice reach out to us that just was looking for help with front desk management. We helped them on the front desk management side. They ended up adding another VA for that back end billing, because you see, in IVF practices, the tests are a little bit more expensive. It's more on the billing side of it where they see the benefits. They can see it at the front desk as well, but because of how much money they were able to recover from having a virtual assistant opposed to not having it before, their business has been booming and now they have 5 virtual assistants. So it's the scaling is real, and it's just by making a subtle change, not changing anything on your workflow. You don't have to add any additional overhead. It's actually more efficient for your practice entirely.
Yeah, I think the efficiency is the key here. Not only hiring someone else in-house or offshore, but
Mhm.
having a hybrid team and then getting that efficiency is actually the key, right? So whenever your team audits a new practice, where do you consistently find the biggest revenue leaks? Is it the front desk or the billing or intake or prior auth?
It's case by case, to be completely honest with you, because you take a step back and I will ask those questions. That exact question, Rakesh, that you just asked me is, where do we see the biggest bottlenecks? Or are we having trouble checking patients in? Are we having trouble having patients show up to their appointments? Are we having trouble recovering those insurances? Are we having trouble even with medical scribing? Like, are we having trouble collect all information while a patient's in their appointment? It's just taking a step back and because every practice is different, but for the most part, we usually start at the front desk with that front desk management, that patient intake, because that's where a lot of the action happens. And then on the back end, where we're handling all billing, claim submissions, and even an AR backlog. If you have an AR backlog that's built up over times because you have missed these claims, we can have a virtual assistant go in there and clean that AR backlog up. So to answer your question, it is a case by case basis, but for the most part, front desk management and the back end billing part of it.
Got it. So you just don't provide like a cookie cutter solution. You just go in and customize it case by
Yeah,
case. You just go audit and then see where the leakage is, and then you plug in wherever it is necessary.
exactly. So yeah, we look at it as we're consultants, right? What is going to bring you in the most revenue? If we add one virtual assistant, because we like to add one virtual assistant to show you how good that offshore staff can be. Because if we're going to
Mhm.
be honest with each other, your practice is like your baby. So you want to be 100% sure on what's going in, and hiring offshore sounds scary sometimes because it's new and we haven't been using it for a while. We're all HIPAA certified, HIPAA trained. It's unbelievable what we do, but we like to start with one just to prove what they can do and how efficient they can be. And then the work just shows itself.
Yeah, yeah. I know I can definitely relate to whatever you're saying with any of these things because one of the provider that we work with, he operates in 14 locations. All the time we hear from him is the broken process, either with the front desk or with the billing or with the intake. And then we get negative reviews on Google because it did not handle properly. That has nothing to do with the actual treatment from the doctor. So
Yes.
the experience with these fronts actually making a lot of impact than the actual treatment from the doctor.
Yeah. So this is everybody, and it doesn't matter what part of healthcare you're in, right? The main goal for everybody working in healthcare is to create a great patient experience and then to have that patient retention. So in order to create that great patient experience, the process needs to be smooth, and no fault to doctors, no fault to provider owners. But if the process isn't smooth to no fault of their own, it creates a bad patient experience. And if I go in and I get a $1,000 bill and my insurance is supposed to cover something, I'm probably not going to want to go back to that office the next time. So if you have someone that is able to handle those claims, and that's just what we've seen over time, it's just trying to create the best patient experience because at the end of the day, that's everything.
Yeah, exactly. So I just want to go a little bit more about one more question on this. So what's broken about how most offices handle prior authorizations today, and then how do you fix it?
I think it's the time consuming part of it, right? So a lot of people have platforms that they can use for prior authorization, but a lot of practices don't. And the practices that don't have to make a lot of phone calls from that front desk manager that we were just talking about, who's also handling the patient intake, handling the chasing down insurance discoveries. So the biggest part of the prior authorization would be the time it takes. Time it takes
Mhm.
to get that insurance and all that information from the patient the days before, because that comes from, if you don't have a platform, it comes from a phone call. And that phone call can take time, just like that insurance verification, insurance discovery part. It takes time, and the time out of your day leads to that burnout. And that prior authorization is a big part of that employee burnout.
Yeah. So, but everything you've described so far sounds fixable. But I
Yes.
want to, uh, I want you to talk about the elephant in the room, which is every time whenever I bring up a virtual or offshore with any practice owner, now the first thing that they say is, "What about HIPAA?" So I
Yes.
just want you to dig a little bit more into it.
Yes. So as you know, we all know what HIPAA is. It's the most important part. Patient information is everything. And we couldn't build a business if we weren't HIPAA certified and we weren't training all of our employees on HIPAA certifications, as well as running audits, system audits on their computers. So we are not a call center. Each of our virtual assistants work in their own house, apartment, wherever they live, and they have a computer that is audited monthly. So we make sure that we cover the boxes of, is this HIPAA certified? Is all this patient information secure and safe? And from years of just tweaking and learning more technologies and even you got to purchase some certifications, but we make sure to check all the boxes and we're completely HIPAA compliant.
Yeah, that's a good process. So, what should a practice owner demand from any VA provider before they sign up?
That's a good question. What should any provider demand from a VA provider?
Definitely the HIPAA certification's big. You got to make sure that your patient information is secure. But I would say service, because virtual assistants you're going to offshore. So the CSMT, the customer success team, is going to be big. Oh, the VA is important, but you also have to know what the VA is doing and how they're handling their day-to-day operations. And you want that communicated back to yourself, of course. So we provide a CSM, a customer success manager, along with the VA when you hire a VA from us, just to give you those weekly updates on how everything's going and what progress they were actually able to do and what problems they were able to fix. Because as surprising as it may sound, a lot of practices don't even know where they're missing revenue. And when we put a
Right.
VA in there and the VA is able to gain revenue that this practice didn't even know they were missing out on, it's like an aha moment that I think every virtual assistant company should provide. Like, if you don't have that aha and that niche to find things that aren't missed before, like, it's great. Like, so if someone says, "Hey, I have a $20,000 AR backlog, can you give me a VA that's going to come in here, chase these claims down so I can clean this up before timely filing?" That's awesome, right? That's great. We know what we're going to do. We know what the VA is going in there for, and they're going to collect that revenue. But if you have a VA coming in saying, "Hey, we're having a lot of trouble with the front desk management," and on their off time, that VA is like, "All right, let me dive into this billing. Let me see if there's any claims that I can chase down." And then they say, "Hey, I actually gained the additional 15,000 revenue today because I was able to submit these claims and they were able to be paid out for the services that we rendered." And then the doctor's office will then reach out to us saying, "This is unbelievable. They found something." And then that's typically when we get the add-ons. And do you guys have more virtual assistants that we can interview and see if we can add on? It's a very important thing to provide something that you don't see, the practice doesn't see.
Right. So you're saying VAs are more on the side of the doctor that helps with the full process, right?
Yeah, so now they can stand anywhere along the hospital workflow, but it's they're, like I said at the beginning of this call briefly, like, we work as consultants, so they're going to be working and finding ways to make your practice better and more efficient. And they're going to be going through weekly training to do that as well. So that's where you get, like, because as a doctor, especially for the smaller practices that aren't able to hire two or three, and they have a lot of jobs that they have to do, they're wearing a lot of hats, a lot of things can slip through the cracks. So a VA is just there to make sure nothing slips through the cracks.
Perfect. So, like, just for our listeners, can you tell us one small story of how your VAs are actually bridging these gaps?
Yeah, absolutely. So I gave you the story about the IVF practice, right? I
Right.
can also give you a story personally about a healthcare practice just down the street. It was a diabetes and thyroid care center, and they were dealing with a lot of no-show appointments and having trouble with follow-ups, just because that they were, like the story I was just saying, they were wearing a lot of hats. So our VA went in there and brought the no-show percent down to 0%. So They were dealing with zero no-shows, which brought them, it was a smaller practice, but it brought them an additional $7,000 in revenue that month. And for that practice, it was huge. And they were able to build. Another story would be, so we deal with a lot of dental practices. And dental practices is another reason, or is another area where you deal with a lot of no-shows. And for a lot of no-shows, it's tough for dental practices because you can't refill that seat so quickly. It's tough. So what one of our virtual assistants that have been in a dental practice has done has been reaching out progressively to the people that have an appointment in a week, and then 2-3 days, and then the next day, just originally with a phone call introducing themselves for a better patient experience, because especially with dentist office, it's not necessarily the most comfortable place to go. So we make sure that process is handled, and that patient is manicured well, like they're taken care of from weeks before, just to make sure that they're comfortable, they're ready, and they're able to come in. And that's another no-show rate that we brought down to 0%. So with the no-show rates and the insurance discovery rates, so if we're talking about the back end billing, I know I jump in from one side to the other here, but with smaller practices especially, and with higher testing prices, you see a lot of success with our virtual assistants chasing down that money. It just brings the denial rate to zero, the no-show rate to zero, making sure everything is as efficient as possible. So those are a few wins that our VAs have provided for our clients.
That's a good story. I just want to jump into like one small trend that I personally noticing nowadays is most of these providers are going into the hybrid model of offering direct pays, like a paper cash, and then offering few of the like procedures. So how do you see that trend going forward with all the providers that you're working with?
That's a tougher question for me to answer. I don't really understand your question completely. Are you saying if they take half insurance and they have cash pay? How do you see
Either
that
half
moving?
inch, yeah, there is one podiatrist with us. We recently introduced cash pay directly for 3
Mhm.
procedures. It's a same day appointment, and then we have a list of deliverables. If you pay
Yeah.
$450, and then you get XYZ with this $450, and you get either same day or next day appointment. So that was he's from California, and then I was surprised looking at it, and then I asked him, why would someone pay you directly instead of using
Their
insurance?
insurance.
And then he told me that nowadays most of the practice owners are thinking to go hybrid. There are a few patients who are willing to pay and then get the immediate treatment instead of
Yes.
going back and forth with the insurances, with higher copays, issues with the reimbursement. So since you're having the VAs, I just want.
Yeah, that's the reason why so I can't answer why or like how it's going to move forward, but like the reason why they're going to that hybrid model and they're taking cash pay is because those deductible costs, right? It makes more sense for the patient to pay out of pocket than it would be to use their insurance. So a lot we have a couple of practices that do that hybrid model, and the conversation with cash pay, like obviously that patient is offering to pay cash, which is great. So that conversation isn't going to be very hard to have, but like having someone there to bridge that gap, to tell that person, hey, and this is for a practice that already is providing that hybrid model. Hey, you're using your insurance on this. It might be better. So to have someone have a virtual assistant in that area, that's what we like. So when we deal with providers that have that hybrid model, our clients, they just are there to have the conversation of like, I keep going back to it, be the consultant on like, hey, this test is probably better to pay out of pocket than it is to use your insurance. And then just being like consulting them along the way there. And that gives a greater patient experience, right? If you're told you're going to save some money, that's always something everybody wants to hear. Right?
Well, definitely. So now, since you have been working with so many practices, what are the best traits that you have seen in the practices that are running smooth and efficient with their process?
Can you, what are the best, I'm sorry.
What are the best practices that few of the well-running practices are adopting nowadays, along with your VAs? I just wanted to know what could be those processes adopted by
So
these
I think,
practices.
so I understand. Thank you for clarifying that. I understand a little better. I think it goes across the whole healthcare field, right? Is fix everything up front. make sure everything is taken care of up front. Because once you let things fall through the cracks and have to go chase things down, then that's when you run into problems and you're not getting paid out for some services that you're rendering. So that front desk management has to be a well-oiled machine. You have to have processes in place, whether it be a virtual assistant, whether it be a technology, whether it be something to make sure that every patient that walks through that door is going to be one insured, or you're going to get paid out for every service that you render, because you're going to school all this time so that you can do this. And then at the end of the day, if you're not getting paid out for it, it's not a great patient experience, but it's not a good doctor experience either. So in order for you to run an efficient practice, it starts up front with that front desk management, that patient intake, that insurance verification, the eligibility, just making sure everything's clean from the point of order entry and from that time that patient registers. And then from there, if you don't have things falling through the cracks, you just got to kind of make it work and just kind of take a step back, look at the workflow, but you're going to be able to, you already handled most of the problems that you before had to deal with on the back end up front. So it makes it just so much more efficient if you're able to handle things from that time of registration. And that would be my number one advice to all practices out there.
Perfect. So is there anything else that I haven't asked you that you think our listeners might get benefit from?
No, just like going back to it, if you're a smaller, medium-sized practice that are looking to grow, but it's tough to hire in-house. That's where we can have a conversation. We are flexible to work wherever along your workflow. We are stationed out of the Philippines. So our VAs come from the Philippines. I don't know if I've mentioned that on this podcast yet, but they're all offshore in the Philippines. Most of them being like having nursing experience or working in a billing company, but they like working for us virtually because one, they get to work in their house and the money over here has been great. So you're getting an awesome worker for a fraction of the price.
Awesome. So for the listeners who are listening here, how can they reach you or learn more about Reva Global?
Yeah, so we're on Instagram, Reva Global Medical. We have a website, revaglobalmedical.com. My name's Tim Boyle. I'm also on Instagram. I post a lot about our company. We're on the TikTok, and I believe we're on Twitter as well. So if you want to find us, revaglobalmedical.com or just any of those socials.
Awesome. Thank you, Tim. Thank you for coming in today. Listeners, if you got value from this, share it with one other practice owner who needs to hear it. Tim's links and Reva's site are in the show notes. Until next time, have a good one.